This is Erin. And so my study is based on the question of what effect does enrollment in HDHP plans have on families with an individual diagnosed with an autism spectrum disorder. So basically, I'll start with my literature review and just establish some things through literature that are important to address in the study. So basically, the first thing that was established was that, families with autism need to utilize more services. It's effective, it's important, it's necessary, it's common. So just service utilization and outcome effectiveness studies showed that polytherapy is, the best idea for this, the actual individual with autism, which includes a combination of multiple different therapies or treatments from different service providers. Drugs, ABA, behavioral therapy, family therapy, lots of different stuff. And so this was the most common and most effective treatment. And the average number of services utilized per child was 3.5. And then it also showed that higher service intensity, which was more services more frequently, led to more favorable outcomes and effectiveness for the whole family. And then secondly, a lot of the studies on, out-of-pocket costs did not include family-based, mental and physical health care costs. And I think that this was an oversight because there is a great deal of effect that the autistic individual has in the entire family for mental health and physical health. So I found some studies that talked about the increased need and how there's just less resources for the entire family for the autistic individual. So that's included in our study is those family costs. And so I found studies that said that there are emotional, physical effects. There's an increase in stress for these individuals, increased time demands, sleep problems, exhaustion, depression, anxiety, panic attacks, sibling issues. And then also there's studies that just showed directly increased pathology for family members, increases in anxiety and depression, and marital stress. So there's more need for services in all of those areas. And then also it showed that there was a financial reduction, and increased financial burden for these families. So not only did they have financial strain from just the amount of services they had to pay for out of pocket that weren't covered by insurance, but also that a lot of times employment was affected. Either they had to reduce employment, or if it's a, dual income household, that one of the individuals had to stay home full time to care for the child with ASD. So, there's less financial resources and they need more of those resources to pay for services because they're not being paid for through insurance. So, there's need for the whole family. And then also, I found some research studies that showed that insurance directly affects financial burden for families, for individuals, of individuals with autism. So that type of insurance plan directly affects out-of-pocket expenditures based on coverage. So they actually found that Medicaid is not great. There's still a lot of out-of-pocket expenditures, but it was actually studies showed that there was more utilization of services more frequently and that more stuff was covered through Medicaid than, other services. And they also found that legislation affects what's covered and how much is, out of pocket for the family. So, non-regulation is really a big issue. And that's why they think Medicaid's a little bit better, is because there's more regulation for Medicaid. But they also found that people that lived in states with more regulation of their private insurance led to less out-of-pocket expenditures. So, there's a need for legislation to regulate, private insurance because they will not cover needed services on their own without being pushed. Okay, so the next thing that I looked at in my literature was just information about high deductible healthcare plans themselves, because they're kind of new, people don't really understand them. And then there's kind of these two views on it. There's this marketing view, this agendized view, which is, oh, they're going to be great. It'll reduce healthcare costs because it'll create this discretionary usage and consumer-based healthcare. So that people will negotiate and, drive down those costs because the public doesn't want high costs for their healthcare. So it's putting the responsibility on the consumer. The issue, we'll talk about that in a second. So there's also, and I found as part of this agendized viewpoint, an actual study conducted by some researchers that were duly employed at Blue Cross Blue Shield, which is a huge ethical, issue. And then it was funded by Pfizer. So it couldn't have been more agendized if you tried. And they tried to act like that didn't affect anything, but it was clear from their attempts to ignore, underreport, and misrepresent certain disturbing effects that it was pretty agendized. And they end up saying that it was just mixed and that there were some positive things, but they completely ignored the really negative things that they slightly reported, and you can see from the results. So I added that into the reality aspect. So the reality of these plans is that they really penalize the underprivileged communities and those with little to no power. So, basically, healthier individuals were less likely to meet their deductible than chronically ill individuals. Deductibles ranged from, $1,200 to $16,000 for individuals and families, which if you're meeting that a year, that's a lot of money. And then usage data found that individuals requiring more utilization of services paid higher out-of-pocket cost annually, which is the autism community, because we talked about it earlier. They need more services more frequently. Okay. And then the reality is that large bills can come from single healthcare expenditure needs. A single trip to the, hospital can result in thousands of dollars out of pocket, which is crazy. Okay. So, and then it places increased burden on the underprivileged to reduce the high cost of healthcare services, because those that are healthier aren't gonna, they're just not gonna go get services if they're expensive. So it's gonna be on the sick individuals to lobby and negotiate and, have to use this power they don't have to reduce the cost of things, which is crazy. I mean, why would you put all the power, all the responsibility on people that have no power and have to go get services? So the discretionary usage argument is not appropriate for the chronically ill individuals. And those most negatively affected included women and individuals with chronic healthcare conditions. So these plans are not appropriate. And then these communities do not have the power to enact these changes at all. So they're not in the best interest of families with individuals who are chronically ill. And so there was some research that I looked at trends when it was still more popular to have a choice about HDHP or, traditional. So they basically found that those that switched were confused about coverage due to the complexity of the plans. They were aware that there were high costs related to seeking services and that they weren't sure about costs of service before utilization of services, and they didn't feel empowered at all to control the costs in any way. So basically, you're just putting on these people that don't feel like they have any power in general. So the main effects of those that switched to an HDHP plan was that, individuals just delayed or avoided completely seeking services. And even it was needed services. People just didn't go get needed services. And that was both healthy and unhealthy individuals. And that they didn't feel like they had any power or resources to adjust the costs, which was the whole point of the thing, is that you have this power to adjust, but that's not true. Okay, so, and then they also found that even with families with a chronically ill member, they also showed higher rates of delayed or foregone costs due to costs compared to those in traditional plans, and for services that were even needed. So they didn't go get services they actually needed because they couldn't afford it. And then also interesting is, if given a choice, families with an individual with a chronic condition would not choose HDHPs. So that's interesting because after the Affordable Care Act, things have changed a bit. And I did find some research that talked about what the effects of the Affordable Health Care Plan would be, and it's actually what's going on right now. So it's interesting because they used statistical analysis of what would happen, and they were pretty accurate. So basically, they said it would cause a major expansion of forced choice into high deductible healthcare insurance plans, which is what I've seen myself. I've had to switch a couple times, so I've noticed this. And then it would mostly affect the vulnerable populations. So the forced choice options are becoming more common. Large, and then another weird effect was that large employers in low-income neighborhoods were more likely to have forced enrollment into HDHP plans, which is crazy because these low-income neighborhoods already have very little resources. So now they're getting HDHP plans. So if you're sick and in a low-income neighborhood, you're the most vulnerable. Okay, so. And then also they found that it was likely that these HDHP plans would cause a shift in, household, like a large percentage of household income going to, healthcare costs. So that individuals could pay between 8 to 27% of their household income directly out of pocket to, healthcare costs, not even including premiums. So, it's just not affordable. It's not affordable at all. And, who can pay those costs? And it's going to be the people that are chronically ill. So the largest financial burden will fall on ill families. Okay. So basically all of that was the justification for my study. That, there's a need for research to show that we have to legislatively regulate these insurance plans because they're getting out of control and it's really negatively affecting underprivileged, communities. So, let me make sure I didn't miss anything. Yeah, and so there's been research around chronically ill, there's been research around HDHP plans, but there's no research that combines the autism, specifically looking at the effect of these plans on the autistic community. So having this kind of research would help with advocacy, lobbying, basically trying to get regulation. Okay. So my question is, what effect does enrollment in HDHP plans have on families with an individual diagnosed with autism spectrum disorder? Okay, so the purpose is to investigate how enrollment actually affects these individuals in HDHP compared to Medicaid or traditional insurance. And it's probably going to be like people who are grandfathered in. And it's going to look at annual financial hardship, utilization of services, and like care-seeking behavior, and then just overall level of satisfaction with their insurance coverage. So I think we're getting a lot of themes out of the actual open part where people discuss about how they feel about their insurance or how their insurance has changed. Okay, so my hypothesis is that families enrolled in HDHP insurance will have higher out-of-pocket expenses, utilize less services less frequently, and then report lower levels of family functioning, report delaying or foregoing necessary services, and report less satisfaction with their insurance coverage overall than those enrolled in Medicaid and traditional insurance. Okay. So the main independent variable in this study is type of insurance. And then a sub-variable in there that we're going to pay attention to is amount of deductible, because I think that's important, is to see, how much these people's deductibles actually are and how that affects, costs and utilization and things like that. Okay, so the dependent variables are costs, so like total financial burden of healthcare expenditures and related autism-specific expenses, and that's going to include family services. So, if a sister goes to get, some sort of therapy or anything like that, that would also be included in that. So then the percentage of care costs compared to the family, so we take that number and compare it to the actual family household income to see how much of a financial burden that is based on income. And then also the number of services utilized, the frequency of services utilized, and then a sub-variable would be like types of services most commonly utilized. So the qualitative dependent variables we're going to look at themes that emerge from the family's opinion about their healthcare costs. We're going to look at their care-seeking behavior and themes that come out of that. And then we're going to look at if enrollment was an independent choice, if it was a forced choice. Okay. And then also we're going to make sure we get demographic information and family individual mental health information in order to conduct like a more in-depth statistical comparison of the independent variables to the dependent variables based on income, race, ethnicity, and severity of condition, because we want to make sure that there's or see if there's any like really specifically vulnerable populations that are getting targeted. So the method is going to be a mixed method design, and it's a survey based on a structured interview. So it's going to be in person or over the phone, and require a single visit, so an hour to an hour and a half. These interviews will be recorded and then observed and coded. The recruitment and participation. So participants will be individuals and families with an autistic individual living at home and is under a shared insurance plan. And then only one individual per family plan can be interviewed in the study, so we don't have, dual results. Okay, so participants will be recruited through flyers, newsletters, phone calls, and emails. And then those will be kind of distributed either by us or through those who we're going to partner with, which is the bigger organizations like Autism Speaks or, some of those larger organizations. And then also autism treatment service providers. So there's a number of providers like around this area that would likely help us out and, distribute or give us information they can give us. Some confounding factors are that there's a self-selection bias due to the voluntary nature of the study and participation, and then the personal nature of the data collected. So there might be some, personality types or individuals that are more likely to, volunteer their time, volunteer all that information that's really sensitive. Also, there's a bias related to recruitment of participants through the service providers. So they'll likely have similar insurance coverage, or they'll likely have similar usage of service because we're going to the specific service providers. So, the hope is that we can get enough, like we can partner with enough that enough service providers that we're not getting too much information for just one. Okay. So the measures are, so some of the measures that are quantitative are already numerical in nature, so we won't have to code for them or create a number-based coding system, like cost of service, number of services, frequency of service, things like that. We're going to look at cost and deductible and premiums and things like that from an annual perspective. And then frequencies of services, things like that, we're going to do per monthly, which then we'll look at, yearly because we'll have month. Okay, so qualitatively, we'll code the opinions about services, types of services sought, descriptions of avoidance or delay in service utilization, and descriptions of familiar functioning. And we'll be using a coding system derived through observation and emerging themes. So it's going to be, as we watch, we'll see what themes come up. And then the themes will be separated by positive themes, negative themes, and neutral themes. And then these quoted qualitative themes would be compared against like type of coverage, and then deductible level, and then the demographic and demographic characteristic variables that we described earlier. Okay. So for the data analysis, we'll use a multivariate statistical analysis because there's just a lot of variables that we're exploring. And so we need a multivariate statistical analysis. So we'll use both the qualitative and quantitative data for this point. And the quantitative data is just going to be compiled from the interviews. It's numerical. It's already there. The quantitative questions will be coded. So we'll use once we figure out those themes, we'll base things off the themes. So similar research studies to this one present using multiple logistic regression, and it appears that might be appropriate for this study as well. And so then we would just compare the dependent and independent variables and just to determine the effect of these plans on this community, and then use that to advocate. Okay. All right, guys. Thanks for hanging in there with me. Bye, guys.